Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa, and I am joined today by Rebekah Scroggy, another nurse. Thank you so much for joining me today.
Thank you for having me. I'm so excited to be here.
I'm so happy to have you. So, Rebekah, you and I found each other through social media, and I don't know who liked whose posts first, but I know your post about motherhood and how to get the best nutrition for our babies really resonated with me. And I have a lot of personal experience with that, but that is not the area of nursing I worked in at all. So I'm really looking forward to learning from you today and hearing your perspective on how that informs your answer to the billion-dollar question.
Yeah, absolutely. I'm just so glad to be here. Through my own experience as a mom and, my own infant feeding journeys, I became who I am. And I think it really impacted myself. And I know a lot of other lactation consultants and nurses that are in the field that they're in because of their own lived experiences. So, absolutely. I was a nurse. I started as a nurse 8 years ago now and was an ER nurse, pediatric ER nurse. I swore to death I was going to be one of those nurses that was in a helicopter and like jumping out and saving people. And then I had my first son and I got hit majorly with postpartum anxiety. And so that experience really shifted my priorities, my interests, my passions. I was the first on either side of my family or my husband's family to exclusively breastfeed. And so that experience in of itself was challenging. And, I did a lot of investigating, a lot of research, a lot of looking out at different groups to try to find, how do I do this? How do I breastfeed a baby? Because unlike what they tell you, it is not all natural and comes to you like you think it's going to.
It might come naturally if you've seen it done your whole life and everyone around you has done it and can easily give you tips and tricks. But when, like you said, if you're the first person you know to have been doing it, then you're like, who do I even ask? Right?
Exactly.
Something that your OBGYN office helped you connect with anyone with, or how did you find that support?
I think like a lot of moms this day and age through social media. So I did have a lactation consultant at the hospital. I did have a pediatrician. Um, the pediatrician told me that I just made skim milk, and that's the reason why my baby was eating all the time and was so skinny and had a hard time gaining weight. And I knew that that did not make sense. And so I trusted my mom gut. I did a lot of research, like I said, on Facebook groups and hearing from other families and other parents, and found this phenomenal breastfeeding group on Facebook that no longer exists anymore. That's how long ago it was. And they kind of really helped guide me. It ended up being that my son had a pretty significant lip and tongue tie. And so I never had pain with it. Most of the time, that's like the first red flag is that you have pain with nursing. I never had pain with him, but he could not transfer milk to save his life. And so once we got that fixed, like literally the next pediatrician appointment, the pediatrician was like, "So what are you supplementing with?" And I was like, "Absolutely nothing. He just can actually nurse now." And we went on until he was 2.5. But that experience was, I hate to say life changing because it sounds so cliche, but it was absolutely life changing for me. I had that support of that Facebook group. I started off in my lactation journey, like lactation provider journey, by being a volunteer for that Facebook group. So I would help admin it, I'd help moderate it, and I loved it. I loved getting to talk to other moms. I loved getting to help people answer those questions that I was searching for so long during my own journey of pregnancy and learning how to breastfeed. And that just developed this huge passion for me. Also, please note, my son was born in 2019. So the weekend of his first birthday is the weekend that the whole world shut down, the pandemic.
Yeah.
So he was March of 2019. And so for his first birthday, we literally had his birthday party. And then the next day, the whole
Oh, no.
entire city shut down. So that was also hard because please remember, I had raging postpartum anxiety. And so having raging postpartum anxiety plus being in a pandemic, I was terrified of my baby getting sick. And so what ended up happening is I ended up leaving the hospital, leaving the ER, and I started working in the health department. Um,
Working in the hospital.
so I no longer worked in the hospital, did the health department, and that was such a great experience for me, very healing. I did it through the program called Healthy Start. So helping pregnant and postpartum moms, learning how to be moms, basically. And I got to do breastfeeding classes and go to baby showers, and I loved it. And I started thinking, could I be an actual lactation consultant? And I didn't know if that was possible. I'm an IBCLC, which is an international board certified lactation consultant. It is a pretty intense process to get that certification. It took
What's
me,
involved in that?
yeah, so it's 95 hours of clinical or of didactic learning. So classes, things like that. And then you have to have either a medical degree or some sort of equivalent, or you have to have 14 college credits for like algebra, statistics, biology, those types of things. And then you also have to have clinical hours. Yeah,
So by medical degree, you don't mean medical doctor, you mean
just some sort of healthcare degree. Yeah,
like
yeah,
any, would that qualify like any allied health professional, like not just RNs, but LPNs or
yeah.
um, are there other guys?
Dietitians,
Yeah.
uh-huh, nutritionist, um, I think even like dental can also count for it too. I don't remember the full list off the top of my head. And then you have to,
If
yeah,
they would be able to pick up on those tongue ties faster.
yeah, and that is something that is so true. And if we could get babies in to the dentist sooner, then yes, absolutely, I think so. Most people don't take their babies into the dentist until they're toddlers.
But at least they're
Uh,
what the mouth is supposed to look like.
Yes, yes. Speech language pathologist and occupational therapist, both of those are two that are those allied health professionals. Some sort of, basically, you have to have a college degree that you had those basic college courses of chemistry, anatomy and physiology, biology, statistics, algebra, those types of things.
You
If you
mean,
don't have those degrees,
you mean STEM classes?
those STEM classes.
STEM classes that all nurses have to take? Is it
Exactly.
nursing is a STEM field? Yeah.
Okay. That one. Those right there. So if you don't have that degree, you can still take those classes separately. So you don't have to be like an actual healthcare professional to become an IBCLC. Um, so if you have your prereqs, you have your lactation education specific hours, the 95, and then you also have your clinical hours, then you can sit for the exam. So I had to have 1,000 clinical hours of supporting moms with breastfeeding. Yeah, so it took me about 4.5 years to get it, and you only have 5 years to do it. If you do it, if you are past that 5 year mark, you have to retake those the lactation classes. They expire. So I took it. I decided to do it with a lot of support from my family, my team at the health department, and I took it and I passed it. Um, and then I ended up leaving the health department to take a lactation position in the hospital. And at the same time, I started working where I work now, which is Ceres Chill, is a breast milk storage company, amongst all the other amazing things that they do. And hospital was great. Hospital's hard. There's a lot of um, hmm, there's not a lot of support, unfortunately, in the hospital. And a lot of that comes from just hospital life, right? Unfortunately, hospital is an industry as a whole. And so the goal is to get patients in and then get them out. And especially when that comes to birthing, we want you to come in safely, have your baby safely, and then basically stabilize you and get you out. And that makes it really hard to provide that really um, personalized lactation support when you are just hanging on for dear life. Like you went through the biggest transformational thing that you've ever gone through, pushed a baby outside of your body, and then you're leaking, you're bleeding, you're not sleeping. Somebody hands you a brand new baby and say, "Good luck, go home, have fun." And you're like, "I don't even know how to take care of myself, much less a new baby." And so, unfortunately, the hospital doesn't really, it's hard to have that truly supportive lactation experience, which is what I was wanting to provide. So I started working with Ceres Chill and doing working more with Ceres Chill and doing private practice as well. And I that's kind of how I got to where I am now. So it's been a journey.
So, as private practice, do you mean as a lactation consultant or in a private practice? And you,
No.
okay.
So I do private practice as a lactation consultant. I do home visits and virtual visits in the Louisville, Kentucky area, which basically means I go to that mom's home. I don't make her get her baby in a car seat. She doesn't have to meet me somewhere. She doesn't have to worry about getting dressed. Girl, wear your PJs. I don't care. And then we do usually like a weighted feed. So I'll weigh the baby before we feed, and then I'll weigh a baby after the feed. And then we'll also do like a full oral assessment to check for those oral ties or some sort of oral dysfunction. And we go over positioning, pumping, anything and everything you can think of. So it's really amazing. Most of my visits last about an hour to 2 hours, which you don't find that anywhere else in the modern medical system. So, um, yeah, I love it. I love getting to help families in their infant feeding journeys.
That is amazing. And then with Ceres Chill, that is like you're an employee there, but then you're the business owner for your private practice, right?
So I'm a contractor for my private practice. The business is called The Better Boob, and she is actually the owner of the business is actually based off of Raleigh, North Carolina,
Oh,
and so I am like a contractor for her in the Louisville, Kentucky area.
okay. So they find, so like people who need you find you through them usually.
Mhm.
Okay.
Or local or through their insurance, there's different options there, yeah. And then Ceres Chill, yes, I'm an employee there. I do lactation support for them. We work on wholesale. I do social media and things like that. So yeah, I guess, my goal is just to help families have that support and education that I did not have in my journey and maybe make the world a little bit better.
Yeah,
That's my
definitely.
goal.
So when I was, I breastfed both of my children who are now like 9 and 15, and each of them for about right at a year. One of them
Mhm.
quit a week after, one of them quit a week before, and I probably would have gone longer with each of them. So it's a good thing they quit, so that I could move on. It's hard to
Mhm.
be the one to make the
It
decision.
is. It is. Yeah.
My daughter wanted to nurse upside down at the end, and I was like, "You're done. Here's a bottle. Bye." She's busy.
I love it. I call it nursing gymnastics. It's hilarious.
Right, exactly. I was like, "This is not good for anybody." Uh, but, it was the first time I tried, I was in the hospital, and a
Mhm.
lactation consultant came in, and it was a male lactation consultant. Did you have any that you trained with or have worked with before?
Oh, so I know some in the professional space. There's not very many of them. I think it's great to have that male support systems. And I think that it's awesome that there are men out there that are willing to learn, educate, and support families in this because breastfeeding doesn't have to look just one way. And I think that that's a really unique thing about it because a lot of times in healthcare, it's a very this or that kind of situation. And with breastfeeding, it's not, which I think is really fun too.
Yeah. And I mean, it's definitely good to have, any ally in breastfeeding we can get.
Yeah.
But also, I did feel like it was awkward for me. But
Mhm.
I know there's a lot of women who prefer to have, for example, a male doctor.
Yeah. Yeah.
That's a
I
whole
will
other
say,
that's a whole
yeah.
other realm. But at the same time, I'm glad that there is someone for people who want that, right?
Yeah. Yeah.
Um,
Do you think that it impacted how confident you felt in breastfeeding?
um, I don't know because I did assume it to be easier. I did grow up with my mom had 5 other
Mhm.
kids after me, and I had seen her nurse them, but then and then I grew up in like a homeschooling community of people where
Mhm.
everybody was doing it. And so
Yeah.
I assumed it was going to be easier than it was for me. And and so it turns out my husband was on Facebook, and somebody he went to high school reached out to him and said, "Congratulations on your baby." And um, he was like, "Thanks." And she was like, "How's everything going?" And then I don't know why he felt the need to volunteer. I mean, Rosa's struggling with this breastfeeding thing. Like, I don't know why you bring that up to somebody you haven't seen in 5 years. And, and she was like, "Oh, well, I'm in Liliche League and I would be happy to come over and, see if I could do anything to help or at least encourage her." So she came over and she demonstrated and we nursed our babies next to each other and she like talked me through some things and then introduced me to a Facebook group that was super helpful and just really normalized the process, which I already expected it to be normal,
Mhm.
but for whatever reason, my mom had not nursed a baby in a long time since,
Yeah.
and so it wasn't fresh in her
Mhm.
mind, right? And she never had a boppy pillow. Which those things are miraculous. Um, yes, this friend, I had one that was given to me
Yeah.
in the baby shower, and she was like, "You need to be using this." I was like, "I didn't even know what this was for," you know?
Actually, my husband would use one as like a neck pillow when I was pregnant while he was playing his video game because he's like, this is awesome.
Oh, yeah.
Um, so
I mean, they're very
lots of many uses.
we definitely kept using it for a long time after that.
Yeah,
And, so I I do feel like, those Facebook groups can be helpful. Of course,
absolutely.
you know, as a nurse, you're always worried about like finding valid information.
Yeah.
But when there is no information
Yeah, yeah.
given
Well,
to
and
you,
this is what I tell to people all the time is
yeah,
that families are going to get their information online through either people that they don't know, that don't need to be telling people because they're telling them wrong things, or they're going to learn from people like you and I that are on social media that are
mm,
going to actually give them evidence-based advice. And I think that that's the difference is like, we were in nursing school and it was drilled into our heads. You don't go on social media. You don't tell people that you're a nurse because of the risk to your license, right? And then when I became a lactation consultant and I keep getting all these people who are like, what website do I give moms to look at? And I'm like, your 20-year-old mom is not going to go on the CDC to read. That's
no.
not going to happen.
Also, if
They
she,
will go on TikTok.
yeah, but also if she went there, it's like, would it be something that would be easy to read and understand and
No.
process in a way that would be
Yeah.
easy to apply,
Exactly,
right?
exactly. Yeah.
Because it really needs to be packaged in a way that people are able to receive, especially really sleep deprived people.
Yes. And they need those short bits, which is where social media comes in so well, is like, Reels and TikTok and things like that. Like it's easily digestible, it's easy to understand, and it's in a format that they understand. So, that's what I tell people all the time. They're like, social media is evil. And I'm like, it's really not. Because if we're not on there, where else are they going to learn it from? They're going to see these moms that are pumping 20 ounces at a time, and they're going to think that that's normal and that their normal output is not enough. And then they're going to be like, I don't have enough milk. And so then they're going to switch to formula. But they have a perfect amount of milk. But just because they see this mom pumping 20 ounces at a time, they feel like they're not making enough.
Yeah, I have another story about that
Oh.
because with my second child, we went in for the baby appointment a day or two after discharge from the hospital.
Mhm.
And she got weighed, and they're like, "Oh, she lost a pound since she was discharged from the hospital. Like, she must not be getting all she needs." And I was like, "Well, I really want to breastfeed it. I was able to do it fine for a year before. I should be able to do it again. Maybe it just didn't come in, right? Because it takes a day or two sometimes for the milk
Mhm.
to come in, which
Yeah,
is another reason it's not ideal to learn how to breastfeed in the hospital because there's not a lot
absolutely.
to work with.
Yes.
Mm, as far as like not a lot of evidence, those weighted feedings are not going to show up on
No,
anything.
no.
Um, And so they're like, well, pump every 2 hours in between breastfeeding sessions so the baby is learning, but then also you're teaching yourself to produce more. We go back in a couple days later. She had gained another pound in addition to what they had weighed before. Turns out their scale wasn't zeroed correctly the first time. So I ended up overproducing for a year and
But to
ended up
say,
donating
they
100
where were
ounces
you?
to the milk bank, which is something I wanted to bring up.
Yeah.
Like, I don't know if you were saying Ceres Chill does wholesaling, but the milk bank I donated to after like they took blood work, kind of like donating blood.
Hmm.
They test you for all kinds of things to make sure you as a person are safe, and then they, I believe, pasteurize it lightly and then mix it with a couple other moms' milk and give it to like NICU babies.
Yeah.
So, super important. So if there is ever like an overabundance of supply, like in those cases you were talking about, it would be really great to donate to something like that, and get that opportunity. Like they covered the cost of having the labs done and everything.
Yeah. Oh, yeah. 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 And it's a really amazing opportunity. I've gotten to visit one of the biggest milk banks, the University of California, San Diego Human Milk Bank. And it's just it's amazing what stories are wrapped up in there. A lot of people think donation is just only if you lose your baby,
Oh,
and that's not necessarily true. There are many, many moms just like you that had an excess of milk. It's either going to go bad in the freezer or you can donate it. And you know that NICU babies are getting fed. And it's really important to have that donation because there's a thing called necrotizing enterocolitis, which impacts NICU babies. Basically, what it is it's like a bacteria that goes in their gut. You know this, but it's very, very dangerous for those premature babies. Um, it can cause them to have surgery and remove part of their intestines. Sometimes it can even cause death. And there's been a ton of research on this. And while it's not like a magic bullet, um, human milk helps prevent the chances of a baby getting that, which is not surprising because we know that human milk is amazing and has all of these benefits and so it's not surprising that it happens like that, but that is impossible to do unless we have donators like you. So amazing moms like you that donate that excess milk. So it's a really, really cool program. And there's a bunch of different ones. There's the milk bank, I think, in Indiana that's close to here. And there's different depots. So even if you don't live next to the milk bank, they have places that you can donate it to and then they'll come by and pick up the milk. So it's amazing. It's an amazing thing, honestly. It really is.
yeah. And so, what is Ceres Chill and how is it different?
Yeah, so Ceres Chill is a company that produces products. So we create products to help make breastfeeding easier and more attainable. So our most popular product is our OG chiller. Our chiller holds 27 ounces of breast milk, and with just ice, it will chill it down and keep it chilled for up to 20 hours. Yeah, it's really, really cool. And you can pump directly into it, so you don't even need to bring bottles with you. You can even put your bottle top on top of it, so you can feed out of it as well. It's a really, really, really amazing product. And I started with the company as a mom first. I saw that on Instagram, social media, and I was like, holy cannoli, this is the coolest thing since sliced bread. And then I reached out to them and I was just like, hey, I'm an RN, I'm a CLC, like I'm a lactation provider. Is there anything that I can do to help support your company and maybe work with you? So I started off as a contractor, and then we just built up, and now I'm full time with them, and I absolutely love it. So one of the things that we are so big and passionate about is actually milk donation. And so we work really closely with different milk banks and with the Human Milk Institute to help just elevate. Our founder is actually on their board. So it's a really amazing thing that we're able to help support with that. So
Yeah.
absolutely.
So let me ask you before we get to the $1 billion question. It's time. Um, is there, so we were talking about these Facebook groups that benefited us. where would you send someone now other than a one-on-one session with you, which would be wonderful? But like for ongoing support, do you know of anything you can refer people to?
Yeah, absolutely. So actually at Ceres Chill, in addition to having these products, we also are about support. That's what every family needs is just more support. If there's anything that you could do is just more support. And so we have a Facebook group called Judgment Free Breastfeeding Support. And it is one of those places that it's completely judgment free. You can come in and ask any questions. There's no such thing as a silly question. You're going to find a community that can relate to you. But then I'm there every week answering questions. So if you have a question that you're like, I don't know if I need a lactation consultant, but I just kind of feel like I need to ask a question, that's what I'm there for. So yes, and I will be happy to send you the link to that so you can share it with your viewers because
In the show notes.
um, yeah, absolutely, because it's a really amazing group, and it reminds me very much so of the group that I used to be in that no longer exists anymore.
Good. And you were
So
able to kind of help recreate that then, huh?
yeah, yeah, yeah. It's a very special group for sure.
When you say judgment free, you mean like, I just want to clarify because a long time we were saying breast is best, but then some people would go without, like their babies wouldn't get fed if they weren't making enough. Like that is a real thing that happens. We're not being
Absolutely.
dismissive of that. And so we do want to say fed is best. And so if
Yeah.
you supplement with formula or you need
Mhm.
to have formula, that is okay too, right?
Yeah, absolutely. And it's not even if you need to have formula. If you choose to have formula, the cool thing is we are not a third world country, right? We have access to clean water. We have access to safe feeding practices. Um, there are still benefits of breast milk that you will never recreate in formula. But in third world countries, choosing formula can sometimes equal death and malnutrition and things like that, right?
Because of the
But we don't
process.
yeah, the water access, finances, can they afford formula every month? Like, there's lots of different decisions behind that. Do they have access to storage to keep it safe and clean? That's also another question. But here in the US, a majority of water is safe to drink from. With
In Louisville, Kentucky, where we are.
exactly, exactly, exactly. And there's amazing programs like WIC and SNAP that help provide coverage for the cost of formula. But when we're talking about those babies that died with that breast is best, is especially, I know you'll get this, in women's healthcare, there's a tendency to just throw out these sentences and let it be all consuming. Breast is best, but supported is best, honestly. We need to have more support. And the problem is those babies that died, a lot of times it was because that mom went to somebody and said, hey, something doesn't feel right. And all the provider did was just say, just feed more often. Well, that's all good and fine, but if mom's not making enough milk, or if baby has a severe tongue tie where they can't transfer milk, that baby could be on the breast 24/7 and still not be getting enough milk. And that's where we see these really terrible stories coming out of. So I really don't love breast is best and I really don't love bed is best. I really like supported is best because that's that's the end game here is we're just trying to support families to make the best decisions for themselves.
And that is the perfect segue into our $1 billion question because maybe I have an idea of what you're going to say.
Yeah.
Um, so, here's the question, Rebecca.
All right, let's get it.
If you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
That is such a great question. And I have like three things that I would want to do. Um, and I would obviously have to consult with a financial person because it probably is not enough to do all three things.
Well, that's the strategy part, right?
Yeah. Honestly, what I would love to see is more education to all providers. Um, you know, pediatricians, OBs, lactation providers, like everybody that education about that breastfeeding. So when that mom does come to the pediatrician and says, hey, something feels off, they're not just saying, oh, you make skim milk, just feed the baby more. Like that's not helpful support, period. Like I get the intention behind it, but it's not educated and it's not helpful. So I would love to see more education, but we need in the lactation world, we need more um consistent education. And
Mhm.
that's the problem is that IBCLC certification, that exam is entry level exam, right? So it's just, the basics of lactation, but there's so much more in depth beyond that, like oral ties, pumping, low milk supply. What if you're working with a family that is a male but I identifies as a female, like they're like a trans mom, like those are things that are not covered in that basic education that needs more specialized support. And so those types of situations is so what it comes down to is education. I'd love education as a basis for all medical providers, and then also more across the board specialized higher level education for lactation.
And I
Yeah,
would love to have it easy to recognize resource to say,
yeah.
go here for more support.
Yeah, yeah, because
Somewhere we
people tell you all the time, just go talk to your pediatrician. But
don't.
in medical school, most medical schools get 3 hours of lactation specific education. So explain to me how 3 hours is enough when I had to take 95 hours of lactation education. And I'm telling you that that was just the entry level. 3 hours is not enough at all. Like that's not going to do anything. So that's where that's where those holes are in that Swiss cheese model of like where can we best support them. Pharmacists need lactation education. There's so many pharmacists that will tell moms, doctors need lactation education.
Mhm.
When a mom is coming in after she gave birth and she is needing a CT and the doctor says, oh, well, you have to pump and dump, or that doesn't have a pump for her. So how is she supposed to remove milk safely so that she doesn't get mastitis or some other infection because she's not able to pump? Because we all know ERs are not a 2 hour thing, right?
They're
No.
not.
No,
There's just no part of it that is a
there's
thing.
none of it. So that's where I would love to put that money is education at foremost, and then support for the families. Um, there's research upon research that supports that if we had paid maternal leave in our country, that breastfeeding rates would go up, childhood illnesses will go down, and then the economy is happier and families are happier.
Baby,
So
you gets better.
yeah, exactly. So there's so
Bond
much to
gets
it.
better. So much
Yeah,
relationally trust. Maybe people
yeah,
would feel less lonely. Like,
exactly,
I mean,
exactly.
these are things that can be all like traced over time. And so, um, you know, when we're talking about addressing social determinants of health, one thing I am going to mention every time I can is the social determinant of health that is loneliness. And I think there's so many contributing factors to it. Um, and so hopefully building community like what you're doing for new moms will help meet some of those needs and, help with that mother baby connection. Like, I know so many moms who are nurses who would love to breastfeed their babies, but they have to go back to work. Like, they can't afford to not go back to work whatever situation. And I've known plenty who felt like they could not do their job safely as a nurse if they had to take lactation breaks or their coworkers would not be supportive. I had very supportive coworkers and I'm so, so thankful for them. But I did feel guilty whenever taking breaks because nobody's coming to the hospital on vacation. Like
Yeah.
everybody is a patient because they need to be. And um,
Well, and you have units that
it
are
wasn't
super
for
busy
exactly.
that you don't get a break. You barely get a lunch break. They're not going to be able to come and give you a 30-minute break every 3 hours. Like
Oh
that's just not going to happen.
like, I was very lucky that, like, I had been doing all that, pumping practice while
Hmm.
I was at home, and people were amazed that I was done so quickly because, like, I
Hmm.
was trained.
Yes, yes,
And it would be done in 10 minutes, and so that was great. But,
yeah.
that is not the case for a lot of people,
No.
and, um, so I think, there's cultural supports, there's understanding supports, and then as nurses, we talk about, how we're trying to reframe the culture where nurses eat their young to nurses feed their young.
I love that.
Yeah, it's so beautiful. I'm so thankful for the work that's being done to reframe how we support one another. But I think this is one of those areas where nurses, who a lot of them are going to be mothers while they are having a career as a nurse, um, that we need to be understanding of supporting one another in those situations. So,
Absolutely. Yeah. And that's, one of the things about Ceres Chill is we're really very passionate about that. We actually have on our website that if you're having a hard time creating a pumping schedule, we have like a whole blog on it so you know how to pump when you go back to work, what that looks like. And then also we have a downloadable letter that you can hand to your boss so that so that they know what your expectations are for pumping. So for instance, when I was working in the ER, the pumping, the lactation room was 3 stories up. I didn't have time to go off the unit 3 stories up to sit in the lactation room. However, I had a really supportive manager who found a old storage room and was able to, there was a couch in there and there was an outlet. And so I was able to use that. But if I had not had the ability to go to my manager feeling supported, which not everybody has that luxury, um, then I would have ended up not going to pump because I wouldn't have felt like I could go 3 stories up to go to the lactation room. That's just not always possible.
and what if somebody else was in it?
Exactly. Yeah,
Yeah,
yeah.
that's another
So,
thing is, I worked in one hospital that had, um, like, several stations where you could,
yeah,
uh, be pumping at.
that's
There
so
were
cool.
2 or 3 different little cubbies with curtains, and
Yeah,
I've been to one where it was in the basement next to the morgue.
that's nice. Nothing that will get that oxytocin flowing like that.
Like, I had to go down 3 floors into the basement and be next to the dead bodies. Not in the same room, but still, it's like that was the next door, right? And it was just like, this is the vibe, circle of life here happening. Thankfully, I had a
Not the
manager
vibe.
who did. I talked to my manager about it, and they did say I could use a different room that was like an on-call room.
Yeah,
But then a lot of the expectation is, oh, just go use the bathroom.
yep, yep. Which is
However,
legally not the way you're supposed to do it.
could you speak more to that?
Yeah, absolutely. So we have federal protections in the US. It's called the Pump Act, where you have to be provided a private space that is not a bathroom with a locked door so that you are able to pump because it's gross to eat in the bathroom. Just like we wouldn't expect you to eat your lunch break while you are sitting on the toilet, we are not expecting you to create your baby's lunch while sitting on the toilet. That's just really gross and dehumanizes the whole situation.
I'm
Um,
sorry, we're nurses. It isn't
yeah,
an entire profession based on hygiene.
yeah.
Like,
Hygiene and empathy, like, I don't know, maybe that too. So,
maybe,
um,
but definitely.
maybe. So yes, so there's some really options. You can use managers' offices, anything that has a lock on it. A sink is a plus, but it's not necessarily required. It doesn't have to have a sink in it. It just has to be able to lock. And it has to be a private room. So
And that's very helpful for people to know because, if
yeah.
we don't have, you know, federally mandated and paid for
Hmm.
maternity leave, people might not even know that that is a protection afforded to us. And so,
Yeah. Well, and unfortunately though, I have met many moms who, even though it is a federally protected um thing, that they're so scared of possibly losing their job, or
that's so real.
they get unpaid for it, and so they can't physically take the time off to
Yeah.
go pump, and that's really really hard. So I think you're right of that just knowledge from everyone of the importance of this. I don't know how many old people are like, "Hey, did you have a fun time on your vacation?" Sir, maternity leave is not a vacation. I don't know.
For 4 weeks. Thanks.
Yeah, no, no. I don't know any other vacation where you are bleeding from orifices of your body and you have a whole human being just hanging off of your body the entire time. And changing two people's diapers, your own and your baby's, is included in a vacation.
Right?
But there is that stigma of it in the workplace.
Yeah.
And that comes from like we could talk about that all day long, but that comes from this misogynistic view of women in the workplace. And so, there is that we're also, trying to reteach in the workplace that, it's different. Maternity leave is not a vacation.
Can I ask it from a different perspective? Like,
Absolutely.
I would say there might even be a component that is not necessarily misogynistic from the workplace, but from women keeping men from knowing what's going on.
Absolutely.
And
Yeah.
there's probably plenty of men that don't want to know what's going on. But especially, like, I have found male nurses and male physicians to be some of the most understanding people in the world.
Hmm. Hmm.
And I mean, there's a reason women prefer male doctors sometimes because they don't, maybe they might be even more gentle than some female
Yeah.
professionals because they're like, oh,
Yeah.
I don't want to hurt you, right? But I've seen a lot of older women who don't tell men things and they hide things from men so they don't understand how our menstruation works. They
Yeah.
don't
Yeah.
understand how the lactation stuff works. They don't understand uh, any of these processes because they're shielded from it like it's
Yeah.
shameful. And it's
Well,
not
and
shame.
I think you're right. I think there is some shielding there, but I think there's also a lack of education. I mean,
Sure.
women's health
Truly.
of a whole, yeah, exactly. I mean, women's health as a whole wasn't even researched until like the early 2000s. So, we have this huge lack of understanding in that way of like, yeah, it could be that it's a taboo thing. We're not supposed to tell men that we bleed from our vaginas every month. But it also could be like, I don't know enough about my own body to even feel comfortable to tell my husband about my body or my father about my body. And so it is that weird, what is it that's causing it? You know what I mean? But
Yeah.
yeah, absolutely. And I think that it's really interesting to see this new generation that's coming up, where it's not taboo and we talk about all of these things, and having conversations like this is so important. And it was really cool to see, because I was the first on either side of my family to breastfeed. I there was some uncomfy moments of when I'm trying to feed my baby in front of my family. And my father-in-law, he was always very uncomfortable. He would walk out of the room whenever I was breastfeeding my son. And then I had my daughter, and he finally felt comfortable enough to stay in the room. And I felt like that was a huge improvement for him because while he never said anything to me, I could always tell he was uncomfortable.
Yeah.
And so, for him to finally feel comfortable enough to stay in the room, I felt like was just it was a huge step in the way that I think it needs to be normalized because you're absolutely right. Like,
People want to be respectful. I think most
exactly.
do want
Hmm.
to be respectful and they're not sure if they've never been in this situation. How do I
Yeah.
be respectful in this
Yeah.
scenario? Right?
Yeah, yeah. Well, and our society has sexualized breast for
Mhm.
so long that a lot of times there's that fear of, oh, well, if I'm watching you breastfeed or talking to you while you're breastfeeding, there's going to be a sexual component to it. And it's not. It's you're feeding your baby, right?
And I'm
Um,
really glad he wasn't wanting that to happen.
exactly. Me too. Me too. So, like, and I think you're right. I think a lot of times, like you said, from your own growing up, it's that exposure of learning. The cool thing is I was able to teach my nieces, like, as they were coming, they were like, "Oh, what is the baby doing?" And I'm like, "Oh, he's breastfeeding." And they're like, "Oh, what is that?" And so, like, that education piece, I think, is so important for future generations, so that they're not like, "What the heck do I do? I don't understand. I thought I just put the baby on my boob, and they're not doing anything." Like, that's a good step in the right direction. So education for everybody. And I think that also includes when we're talking about like sex classes and like sex ed classes for kids is the breast and lactation is part of sexual health, and we need to be educating about that. Um,
Is
and I think we would
hope that's
see
included, yeah.
it's not. It is not right now. Yeah. So most sex ed classes are more based on like the sexual intercourse aspect of it. So like how to prevent that, which makes sense. I mean, and that's totally fair. But there's so much more to it than just how do you put a condom on, and So I would love to see that part of that education.
Maybe we
Lots of
could develop
education.
a curriculum.
Yes, and I actually looked into that before I left the health department. But it's hard because a lot of people are not comfortable having that conversation about
They're not comfortable with the whole conversation, though.
exactly,
I
exactly.
mean, let's just add it to the already uncomfortable
Yes,
situation that nobody wants to talk about and somebody
yes,
has to do anyway, so
exactly. Kids are
put it
going to learn anyway, right?
right. Let's make a slide deck they can use.
Yes, exactly. Just send it over. I'll just send lots of TikTok videos. It'll be fine.
Right. Hmm. This is the spicy deck.
Exactly.
Oh, well, Rebekah, this has been so delightful to compare notes with
Yeah,
you and hear from your insight. And I really appreciate you sharing that with us. So,
yeah.
if you've enjoyed this episode of Nurse Rosa's Insights podcast, please like and subscribe wherever you are listening, or if you're watching on YouTube. Give me a thumbs up or even a thumbs down. I was talking to somebody the other day. That does count as engagement, and I'll know you heard it here. Leave me a comment. Let me know about other people with innovative ideas who need to get their ideas out there. So maybe we'll hear from someone with $1 billion to throw at a good cause and they'll want to invest in the future. We can hope, right? And then, Rebekah, do you want to share your social media for people to follow you?
Yeah, absolutely. So you can follow me on Instagram. My Instagram handle is caffeinated lactation. You can also see me on the Ceres Chill social networks. We're on Instagram, YouTube, TikTok, LinkedIn, all the things. And then the Facebook page is the Judgment Free Breastfeeding Support Group. And we'll make sure that that's in the notes so you can easily access that.
Definitely. And I'll be on social media on all the platforms at Nurse Rosa Speaks. And I'll see you in the next episode.